Hello, everybody. Welcome back to the Better Together podcast with Heritage Health. I am so excited about this episode, and I think you're going to pick up a common theme in my podcast. I'm always excited to have these conversations because I love the work that we do. And today I get to talk with two of our amazing board members. Both have just been instrumental in helping this organization move forward. So today our topic really is talking about why this work matters, a boardroom view of community health. Being a board member at a community health center it's an incredible responsibility. We're going to talk about some of the responsibility that lands on board members and then why they do this. But I want to start out, this episode. This organization would not be where it is today without the people that have volunteered and just picked this organization up off the ground, put it on their shoulders, and carried it forward. And a lot of those people have been volunteers that serve on our board of directors. They donate way more time than they have, and they build this passion for the organization. On behalf of everybody that I've worked with, I am so grateful for you guys, for our board of directors, for anybody that served. This is my job, and I work hard too, but working with volunteers that put the time and energy into lifting the community, making it happen in a better way. There's just nothing more special about that. So thank you for being here today. I'm super excited. So I'm going to introduce, we have Liz Montgomery. Liz just became the board chair this year. Liz has served on our board for quite a few years. She can tell you a little bit about that. But Liz brings this passion for building stronger systems, building relationships with the board member. I think one of the coolest things that I've seen is just Liz's passion for building teams, building people together, building relationships. We just had a Christmas party this year, which was so much fun. Again, Liz just kind of put that on her back, and she did it. So thank you for being here today. I'm going to introduce Janah, and then we'll talk about some whys. So Janah Hol, Janah's been on our board for a long time as well, has had multiple experiences with leadership. Janah has become one of my best friends in the world. I'm so grateful for Janah. We've been able to do some incredible things within this organization. I think the common thing that happens with all of our board members is people they have a heart and a passion for this work. And when I look at the two that are here with us today, it's a great representation of our full board and just the vision that they have, the passion and dedication that they have. So thank you for being here today. Janah had been our board chair up until Liz voluntarily jumped into this role with excitement.
She got her arm twisted behind her back. Please.
That's perfect. Well, why don't we start with you, Liz? Talk about sort of your experience becoming a board member at Heritage Health, and why do you do this? You actually you run your own nonprofit. You have a lot of things on your plate. Why are you so crazy?
Well, Mike, I love my community, and I love Heritage Health and the services that they bring and provide for families. And it drives me to know that the services that Heritage Health brings to our community makes it a better place to live, and that I'm part of a project that's truly changing lives and getting people healthier and our community stronger. So it's an absolute pleasure and honor to serve with Janah and the rest of the board and be there to support you in the mission of Heritage Health.
Thank you. Yeah, it's been so fun. I've known Liz for a long time in the community, and her work around sudden infant death syndrome and just keeping this community safe with car seats and safe sleep and all these things. Liz, again, just another great example of people in the community that just pick something up that's super heavy and turn it into something that is impactful and saves lives. And it's amazing. So thank you for being on the board, and thanks for all you do for the community.
You're welcome.
Well, let's jump over to Janah. Janah Hol. Why do you do this?
Oh, Liz said it so well. It's hard to beat that. But for me, it kind of started with volunteering and really wanting to make a difference and leave a legacy behind. Again, just like Liz said, I wanted to be part of my community and be part of the solution, because at the time I had little kids and I was seeing issues with primary care and getting healthcare services generally here. And I just thought, I'm in healthcare. I thought I could probably at least be a warm body to do some work. And so I started volunteering. And of course, once you kind of dip your toe in heritage, you just like want to jump right in. So I jumped in, and I don't know, maybe within the first year, you asked me to be the board chair, which was a very odd choice on your part. But I learned a lot, and I went through a lot, and our whole board, like, we were really challenged, and we got to rise to the occasion and become stronger for everything that we went through. And then over the years, just getting to participate and be part of the solution year after year, getting to meet so many amazing people in the community, just all of our board members, our staff, our CEO, everybody has such a heart to help people. And so I felt at home, and I felt like I was around people who made me want to be a better person. So in a way, that's kind of selfish, but I have tried to always give it my all. And a couple of years ago, you asked me to be board chair again, and I kind of came into it in a much more educated kind of way. I had gotten the privilege of going to Boise and advocating for us. I had gotten to go to Washington, D.C. There had been a lot of opportunities over the years to grow as a person, as a leader, as a volunteer, and it really helped me to come back even more prepared to help. And again, we were faced with new challenges, different than the first time.
It was going to be easy.
I
I promised Janah, I said, hey, look, we need some leadership again. And look,
2
we're in a
hours a
great
month,
place.
no
Just a
big
couple
deal.
hours a month. You're going to be just fine. And, we had a challenging start to 2025. And, again, just the board carrying the organization through and being there for it. I mean, it was the perfect timing to, be able to have all of your experience to help lead the board through some of those challenges. And we made it through. There's always challenges in healthcare. When I think about, so Liz has got a lot of experience working with boards, teaches classes, and, has just been a big part of the community on that side of it. But so for anybody that's watching, like, why would this episode be interesting to them? Like, what should they know about a board of directors, and why should someone think about getting involved at a board level?
Wow. Well, being involved at a board level versus, say, just a volunteer, right, is that you get to be in a leadership position with other leaders to help guide the decision-making process of a nonprofit that you are passionate about. So if you're passionate about a cause, I would really encourage you to go volunteer, go help, and then maybe look into a committee position or a board member position, because then you can have even more impact on that nonprofit than, say, helping mailing letters. It's really, the board of directors is the heart and soul of an organization. And so if you would like to, up your passion and up your involvement, definitely talk to that group about being on their committee or board of directors.
Well, it's a totally different experience from a volunteer. Early on, my wife Kelly was our volunteer coordinator, and we had an awesome guy that worked with us before, and he was just had all this energy for bringing volunteers in, and there's this magic of like volunteering for an organization, falling in love with it, and then helping to sort of shape the future of that. What's been your experience as a board? Like, what's helped you grow the most as a person from where you were? I mean, I think Janah's, I want to say, one of the first board meetings. You brought a brand new baby in, right? So we're at a board meeting and we got a baby there, and it was awesome.
Mike's
good
like,
advice
me,
for every board meeting: just have a baby there.
Yeah.
Oh yeah.
Your board will be really
Babies
happy, and
so
life
great.
is easy. But it was incredible. So watching, Janah evolve from sort of, volunteers stepping into this to where you are today. I mean, your life has shifted, just you've done incredible things for that. How has serving on a board helped you, and why should someone think about that as far as board service and personal growth?
Yeah. That baby, Archie, is now 10, almost 11 years old. So that's how I track how long I've been on the board. And I do have to say that having that experience early on, where it was an approachable board and I was treated with respect and dignity, even though I was kind of in a transitional moment in my life, was something that made me feel at home and confident that I had made a good decision. So when it comes to being on a board and deciding to spend a lot of your life, for me, it's like a quarter of my life now has been on this board. I think it's really amazing how much you feel like you're giving, or people might think that you are sacrificing or giving a lot, but so much came back to me. And I think I actually texted you the other day.
It was so cool, yeah.
That when I look back at the place that I was, it was kind of weirdly like I was struggling a lot at that point in my life, and I was kind of felt like I was drowning. I was actually going through cancer, and this was my fourth baby, and I didn't feel like I had much to offer, but I just had time, and there's always like time, treasure, and talent. And so I had a little bit of time, and I had a little bit of talent and no treasure, but I was willing to come in, and I thought, or some other people might have looked at me and said, why are you giving so much to this organization? Like, you're spending time that you could be spending on your business or with your kids or, just having fun or something. But the relationships that I built, the pride that I have, the time that was spent with other people who were like-minded, it really leveled me up as a person. Kind of like Liz just said, if you want to learn about leadership, spend time with leaders. And I wanted to learn about service and about giving to other people. And we have board members who have been, especially at the time when I joined, and over the last few years, we've lost a few of them to age or moving or things like that. But when I came on, there were board members who had been doing this for 20 years, people whose lives had been saved by Liz Montgomery and Heritage Health, and they really credited the organization with turning their lives around. So it wasn't that hard for them to give back. And I've been blessed a million times over by that same energy and that spirit that's just permeating this place.
Wasn't it so cool? I mean, I think, the concept of sort of giving yourself to find yourself, in so many ways. And I think, again, you just go back to the legacy that Lidwin left and all the volunteers. I mean, they traded their soul for the health of this community, and they invested it to build something better that outlasted them. And, they had this vision of what it looks like. When we think about, the next year or two for Heritage Health, as board chair and, continuing to support the board, Janah, what's exciting? What's been exciting about this year, Center for Healthy Living, those types of things, but what gets you excied about the next few years ahead? Oh, see, this is the challenging.
We would tell you, but then we'd have to kill you.
Oh, that's right.
Oh my goodness. Where to start?
Yeah.
Well, let's see. So I'm, as you know, Mike, very passionate about our rural communities and making sure that our families who live in rural communities have the same access to healthcare as our Coeur d'Alene families, right? And so what I'm excited about is our clinics in St. Mary's and Kellogg and Rathdrum, that our teams are working hard overtime in those areas of bringing more and more services into the rural communities. And so that's what I am really, really excited about. And of course, the Center for Healthy Living and the next stage for that, and our plans for the walking area, the outdoor area, and just making that a safe space for all of our patients.
No, it's great. I mean, as we've talked about the concept of Center for Healthy Living, for me, it gets me really excited, imagining that space in rural communities all across Idaho, right? Where you create this model where, like, it's really hard to recruit doctors to small communities in Idaho. And we have all these great doctors that we've known about forever that have been the sort of the stable base of healthcare, but they have retired, they are retiring. Rural health is shifting, and I think the federal government has recognized that. There's a big rural health transformation fund that's coming out. There's a lot of investment in rural communities. But I love how you said that, Liz. Like, everybody, like, our goal is to make sure that there's just easy access to care. And, if we can't deliver that in St. Mary's at, particular level, grabbing into, like, utilizing technology to open doors. Like, we can bring a specialist to St. Mary's to provide that expertise that, man, I think in years past, you just wouldn't even think that you'd have that expertise in a small community. And I think that's the cool part about building networks and building community. It's like you can take these concepts and then bring them into, all of the rural communities in Idaho and just do this right finally. And that gets me really excited. Yeah. What's you thinking about, Janah, as you think about, the next little bit? We have a lot of projects that we've talked about kind of in the board space, but is there anything that you're particularly interested in?
Well, our name is perfect, Heritage Health. This is a heritage of service, but also of growth. Like, ever since I've been in this organization, it's just been like getting bigger, more access, creating more opportunities, bringing people into the community that can be helpers. The Center for Healthy Living is definitely a passion project for all of us. It's something we've gone all in on, and even at moments when it felt crazy and it felt scary, we just kept leaning into that. A couple of things that stand out for me, Dr. Abate was a physician here when I came on the board, and he was I always felt like he was sort of like a gatekeeper, like holding the line of like, this is what Lidwin would want, and making sure that we always did right by her and by this legacy that was being created. And now he's on our board, and I get to serve with him and watch his decision-making process and how he always pulls us back to the mission. Carl McMenemy, who is on our board, always bringing us back to what is an FQHC and how do we play this particular role in the community and never give up on that, because sometimes there's this tricky place that boards live in between margin and mission. Like, we have to make sure that we can continue month after month, year after year, but we can't forget about what Lidwin intended for this community. And so it's really cool to get to serve with people like that who are passionate and have such a high standard that we all have to live up to. I think it makes us better board members. I hope it helps you as a person that, is leading this organization. But, Mark Hampy is another person that I go back to. He was a board member and then became the CFO, and we lost him to cancer a few years ago. But he's somebody that, one of the last times I saw him, actually, maybe the second or third to the last time I saw him, we were walking through the future site of the Center for Healthy Living together and dreaming out the spaces. And it was a call center at the time, and it was a ghost town because of COVID. But we were walking through there, and he was frail and he was struggling, you could tell, but he was so strong in his passion and his dedication to the organization. I felt very strongly that he was going to hold us to this responsibility to provide a patient-centered medical home for the people in our community. So
it's incredible. Amazing. I mean, everybody that I think, when I first met Lidwin, we had a conversation about just the right people showing up when you need it. And I've had this sort of, I don't know, I'm an optimist, sometimes a little too much, but I've learned how to be the realistic optimist. But having, Lidwin's message about the right people show up when you need them, I mean, that has just been so true with this organization. When you think about like what a board member does, let's talk for just a second about like the actual function of a board member. What do they do? What are their responsibilities? How amazing are the lunches at Heritage. Like that, we can't pay our board of directors, so they get somewhat warm pizza, oftentimes lots of Qdoba. It's definitely not a fair trade for the time that they spend with us. But what is a board member? Like, what does that mean?
It means a lot.
Yeah.
There's a lot to being a board member.
It's cool that you have both sides of it. You can feel what it is
That
like
is
to
true.
have
Yeah.
a board
That
and
is
be on a
true.
board.
I do have to, yes, take care of my own
Your
board for a
hats,
safe start, and then
That's right.
with Heritage Health, I get to be a board member. So I have definitely a different perspective than most people would, as a person who serves. So what does it mean to be a board member? It means one, that you have passion. That is something that all board members must have, and they must have passion for the cause, and are willing to put in the time to serve, to volunteer, and to make sure that we're also taking care of the organization, right? That our mission and our vision are on track, and with what our organization is doing, we need to make sure that it's within, our mission and vision, that it is impactful for our community, that the work that we're doing. So we're overseers of the organization, I would say. And I guess we get to be your boss too, Mike.
Yeah. That's a great experience, right? It's always good. I love the kind of, as you're describing it, like the protectors of
Yes.
the mission, right? I mean, when you think
100%.
about a board member, I mean, there's this protection role that steps up, and it's a challenging role, because you're going to have great pitches made to you all the time about these exciting opportunities that, we can go down, and then, and they may be the right thing to do, but is it the right time? And, is that the priority number one of, there's only so many things you can do. And I think, sort of living in that space, Janah talked about sort of that space between margin and mission, and like trying to pull it together. It's a real thing. And there's a lot of weight, because there's you just can't ever fulfill all the needs in a community, and you have to find yourself like creating that space to say, what are we going to focus on right now? How are we going to do it well? And then how does that propel us into that next space? But Janah brought kind of a cool list of things that she's thought about as being a board member. Do you want to talk about any of those elements and bring those in?
Yeah, I mean, I think some people might be surprised to hear that we only have one employee, and that's our CEO. That was a surprise for me coming on as board member. I didn't know kind of where our boundaries were at. But as a board, we have one employee. We do have to try and maintain the fact that we have the one employee, and we really try not to get too much into the operations daily. But we're very aware of what goes on. We're very, especially on the executive committee, we talk about things sometimes weekly, definitely monthly, in a really deep dive way. We have finance committee meetings. We have patient care committee meetings. Like, a lot of us are wearing multiple hats even inside the board. And then that really informs, when we get together, that we can make great decisions. Fiduciary responsibility is, I'm pretty sure it's tattooed on my forehead now, right?
I have 90 days.
Yes,
right?
yeah. Yes. Fiduciary responsibility, for those of you who don't know, kind of means that you put the organization's needs in front of your own, that you will never let a bad financial decision or a compliance decision or an operational decision be made as long as you can help it, even if maybe personally it might be better for you to have it go a different way. So the board is encouraged to disclose if we have conflicts of interest, and we work really hard to identify when those might be coming up. But for the most part, you can really feel it in the room. People are constantly saying, what is best for Heritage? What is best for this community? How will this decision impact people in this community now and for years to come? So it's kind of a heavy load, I would say. I would say even more so as a board chair. You feel the pressure, you feel the responsibility. If something doesn't get talked about and it becomes a big issue later, that can really cause a lot of issues. And conversely, if you spend all your time talking about things that don't really matter, then you're not keeping your eyes on the mission and on like where we're really going here. So I would say also that we all try to be kind of like a force for good in the community, going out to networking events, participating in the statewide events, the primary care associations, the national associations of community health centers. So we all are really wearing a lot of different hats and just trying to do our best by all of you. And, you know, we're very appreciative of the opportunity to like, it is humbling. I know that sounds like a weird thing to say, but like some days it's just a heavy load. Like what I decide now, the way I vote, the things that we do, the way we lead our leader, it can have ripple effects that are just like impossible to predict.
No, it's such a diverse role, and when I think about some of the core functions, so I've talked about protector, and you were kind of leaning into sort of the storyteller side. So board members are also a big part of the job is to tell the story, to be advocates in the community. And Liz, you've spent a lot of time on this. One of my a very fun memory I've had with Janah was when we went back to Washington D.C. And Janah experienced the elevators of Washington, D.C. for the first time.
Escalators.
Escalators.
Yes.
And for those that haven't been there, they're like 14 stories high and long, and you're descending up and down from
no
this
warning,
tunnel.
just down into
crazy.
the pit.
Janah was just like, whoa, what's happening here?
I actually didn't know I was afraid of heights until that moment.
Oh my goodness.
It was pretty crazy. But so as a board member, we get involved in just telling the story about the organization. When you think about that as board chair, both of you, you're living that. You've seen it from your role as the CEO. When you think about the story of an organization, of any nonprofit, how do you see a board member making an impact on the story or the future story of an organization?
I would say that board members are Heritage Health's biggest advocates. We have, many of us are patients of Heritage Health. And so telling our own story, right, of patient experience and how our family has been helped by Heritage Health, that's an impactful story, right? And I think it's also our job as board members to be out in the community and talking about Heritage Health and sharing the services that we have and the things that we can do and where we're at. And I think we are probably beyond, after the patients, the biggest, most impactful advocates of Heritage Health are our board members.
Yeah. No, it's amazing. When you get people that have experienced life and then they've served on a board and they have a passion, and then you put them in front of a legislator or somebody in the community. Right. We are always speaking from our hearts when we talk to people that are making decisions, when we're working in the community. It's like there's just this heartfelt thing that comes from anybody that's connected with the organization. I think again, that's just, there's this magic that comes from community health centers and the way that they were designed. Liz mentioned people being patients of the health center. We're required to have at least 51% of our board members be active patients of the health center. When you think of other board structures, that's not a very common theme, but that's a requirement. And when health centers were sort of being put together, the thought behind it was like maybe the government might not do healthcare very well. Why in this concept? Why don't we give some money to a community, put some strings on it, require that patients and doctors and community work together to build something incredible, and that. I think that's been the foundation of the health center model. It's been really exciting. As you've been involved in advocacy and telling stories, do you have an experience you want to share in that frame? Other than the escalator?
Yeah. Well, those are actually the advocacy moments have been kind of some peak experiences of my life. I'm very thankful. I got to go to DC and meet all of our legislators and tell the story of FQHCs and go to some other state legislators and senators. And it was, wow, just an incredible experience. Also to be in a room with FQHC leadership from all over the country, So community health centers are like a major driver of healthcare in this country. And people all over the country are volunteering on boards, volunteering on committees, taking jobs, doing the, launching their medical careers in this environment. And so, yeah, being in DC was a really life bringing experience. And then, even just a few months ago, we got to do a presentation for the community health center, the primary care association for this whole Northwest region, Alaska, Washington, Oregon, Idaho, Montana, Utah. I mean, like so many states were represented there. And we got to do a presentation, Mike and I and Luke Malik, our legal counsel, we got to talk about what it's like to work together from, board leadership, CEO, and legal, how those people all integrate together. And we had like war stories to tell. And we were very vulnerable and open and kind of talking about the challenges. And it was so cool to see people in the room were like nodding their heads so hard they were about to like fall off their chairs because they were just like, nobody's talking about the challenges of, board members are volunteers, sometimes with very little experience. And then we're trying to lead a CEO who's the boss of 400 people and, manages a budget of $25 million or more per year. It's like, it is such a weird dynamic sometimes, but we all just like lean into it. We don't give up and we are patients. We are your neighbors, And so getting to talk about that experience was definitely peak for me. Another huge experience was this spring when Medicare expansion was being repealed. And it was a scary time, especially for those of us who are living the reality of filling that gap and seeing what an organization like ours use it, like in tandem with the Medicaid system, what we were able to accomplish. And actually, a lot of us remember what it was like during the recession when we didn't have very many people covered on Medicaid. And it was like there were dental emergencies, there was medical emergencies. Our Kootenai Health and all of the urgent cares were overrun with emergencies happening all the time. And so this expansion really allowed us to get some like normalcy and kind of be a more functional healthcare system. And this spring, it felt like that was potentially going to be taken away. So we went down to down to Boise, and I remember signing up to give testimony. I wanted to like bring my perspective as a board member, and I was really like scared that there weren't going to be many people advocating. And I walked up to the person making the list, and they said, if we get through every single person on the list, it's going to be 13 days from now. There were thousands of people had signed up to give testimony. And I think we made a difference. I really do. And you can see the outcome of that was that solutions were made and ideas like creativity came. I know that Mike was working, overtime in the background trying to like negotiate and educate. And we were all just kind of giving it our all to say, sometimes the Medicaid patients in our community don't have a very loud voice, but there's a lot of people in this country and in this state who need this care, and we are not going to let them not have a voice. Like, we will amplify their voices.
Oh, I think it's incredible. I mean, I think, Liz, you've seen this in your experience, but the relationships that are necessary to build community, right, are so important, so powerful. We don't always agree, and I think today in today's very divisive political climate, it's very hard to find things that people agree on when you just focus on talking points. But I think what we've learned, and we've really had the benefit of being a community health center where people get our mission, they understand it. Both sides of the political spectrum support health centers, but we have to build relationships. We have to tell our stories. We have to, really advocate for the work that's going forward and demonstrate the value. Like, community health centers step up. We take care of people. We are not perfect. This has been healthcare is challenging and complex, and we have people, and there's criticism out there about things that we've done or things that I've done. That's part of being out there in the community. But every single day, like I am so lucky I get to work with a board of directors that has that singular focus of protecting the mission. And, just thank you guys for, sharing your life with us, and, putting our organization first sometimes. And I want to say thank you to your families as well for sharing, your time with us. It means the world to us. And I think we've done some really good things with it. I've really enjoyed this conversation. Is there anything you want to sort of go out with here? Any, parting stories or thoughts that you have as we, sort of wrap up this episode, but think about, the future, or anything else you want to share?
I was just thinking, to those that are watching, to not be afraid. Don't think you're not good enough
I love that.
to be on a committee or be good enough to serve on a board of directors, because you are. We all have talents. You don't have to be, it's what's part of being a team. You don't have to do everything well. You need to surround yourself with people that are talented and have talents in the areas that you might not. But everybody, to make our community a better place, go volunteer, go serve on a committee, offer to be on a board of directors, because you have talent. And please share it with our community, because it desperately needs it, and it will make our community a better place for everybody that lives here.
I love that. No need to be isolated. It's super
No.
easy to be isolated, but you can find a tribe and go make a difference. And
Yes.
that makes your life better, and it makes the community better. So I love that. Thanks for sharing that, Liz.
You're welcome.
Did you have anything you want to share, Janah, on the
I
way
just
out?
feel like that was such a perfect note to end on. I mean, I'm thankful for all of our board members. We've had, like I alluded to earlier, we've had a lot of people on our board over the years that have made a huge difference in my life, and they're great examples of being in service to other people. And the team here at Heritage, I feel like we need to kind of touch on that. Like, we've had several years of board retreats, and the executives that work here come and are so, they put everything on the line. They're good ideas, they're bad ideas, they put it out there. And you too, Mike, just the humility that it takes to go into a room of 15 people and have to talk about a struggle or a mistake or a challenge, and not have so much pride that you can't admit when something's hard or not going well. I think that we don't spend a lot of time talking about the failures or the struggles, because it's a little bit hard, to admit that sometimes, but we don't take it lightly. Sometimes we've had to make really hard decisions, and I don't know if we'll keep this in the recording, but
That's good. Yeah.
doing reductions in force is probably one of the most painful experiences a board can ever go through. Since I've been here, we've done it twice, and I can tell you it was agonizing. And then to lose our friends and the people that we loved, most of the people that have been laid off over the years have been people that we worked with the most. There were people that were at our board meetings, and we see their value. I say we see their value because they're still in the community doing wonderful things. They're kind of moved on to new opportunities, but they are some of the champions of Heritage over the years. And I just don't want to I don't want it to seem that we didn't care or we took it lightly when that had to happen. Some of the challenges, we talked about the good things that have happened because of Medicaid and being that provider in the community, but there are challenges to working with Medicaid that we have faced as an organization that probably will never get fully realized by people in the community and our colleagues and stuff, but challenges that any normal organization would have buckled under. And we are accountable. We have a group called HRSA that comes and they interview us, and they make sure that we are keeping this ship going in the right direction. But sometimes they call out mistakes we made or struggles we've had, and it's just we know that there's always room for improvement, and we're always striving for that improvement. And that is, I can't think of a single person on the board or the C-suite who isn't trying so hard every day to get better, level up, be humble, be vulnerable, take risks, but carefully. And I just am thankful for the opportunities that we've all had to keep doing that in this community.
No, I think, any real organization is going to go through struggles. You look at you're building a business with imperfect people in a system that demands perfection. And, there's only so much that you can control. But the thing that consistently shows up in organizations that succeed is that just desire. And I think it's what Lidwin, told us, like, never give up. Like, there are always problems. There's always things that we have to wrap our heads around, but we have to stay focused on just never giving up. And, when you have the heart of the organization, that's really the thing at its core. It's like, there's not a problem that has showed up yet within the organization that we haven't been able to solve. It hasn't been pleasant. It's been challenging, and, it's always
Scary.
heartbreaking when, things don't go the way that you think they're going to go. But that's also how you grow and how you strengthen as an organization. I look at where we are as an organization today versus where we were, 15 years ago, and not to my credit, but just the strength of the organization working through problem after problem after problem and getting stronger and better. It's like we're just continuing to evolve. And when I look at the next few years ahead, when we talk with our teams, and we talked about it a little bit at the board, like we're in this really amazing spot where we have an incredible board of directors that's passionate about the work that they're doing. They know where we're going as an organization. We have leaders that are here in the community that want to give it their all. We have providers that care about their patients. They want to do everything they can. We've been able to figure out resources. We've been able to figure out, facilities. We have support from the community. We have support at federal and state levels. I mean, there's this real incredible tsunami of power coming in the healthcare space where I believe, we go back to the vision of the organization, right? This life-changing, world-altering care that comes out of North Idaho because of the work that Lidwin started, that you guys carry as a board of directors. It's exciting. The future is really bright. It's scary. It's chaotic. We don't actually know what's going to happen the next few years. There's a lot of things we can't control, but I think the things that we control is really like how we enter spaces, how we enter problems. We bring all of this history with us, and we're prepared to take it on. We're not afraid. We're bold. We're smart. We're scared about lots of things, but all of that just sort of tempers us. So I've really enjoyed the conversation that we've had today. Thank you both for just being so amazing, such great supporters for me. I mean, these guys, man, they're amazing. Just the support that I get. I think there's a different dynamic, even as being a board chair versus a board member, right? I mean, you get to see all of it. And I've built some of the best friends of my life through these roles, and I'm so grateful. But just thank you for being here today. Thank you for your time on the board. Thank you to anybody that has ever volunteered with this organization. If you've served on the board, if you've said good things about the organization, if you've been a patient, the only way that we get to do this is if we bring everybody along with us. Community health centers and Heritage Health in particular, we are a community resource. We're here to take care of everybody, and we're not gonna stop trying to make the world a better place. And I love waking up every day and going to a place that the whole mission of the organization is very simple. It's just to improve life. And we do that consistently. We do a great job at that. And when we miss the mark, we learn from it, and we come back the next day and we show up and try again. And I think, that's just the incredible power of nonprofits in general in the healthcare space. So I hope you've all enjoyed this episode. Thank you for sharing your time with us. I hope it's been meaningful. If you see these two out on the street, give them a big hug and tell them thank you, because any board member at any nonprofit organization, I mean, they are sharing a big part of their life, and that's how you build community. And I think we are so blessed to live in such an incredible community with people like you, with people that serve on other nonprofit boards. That's how you make the world a better place. So Thank you for being here today. Thank you again for being here, and we'll talk to you again soon.